You are listening to Insight from Captial Public Radio. I'm Pamela Wu. Each year, preterm birth affects nearly 500,000 babies. That's 1 out of every 8 infants born in the United States. Medical professionals believe maternal health and nutrition during pregnancy are key to healthy children, and they are hoping to spread that message. Tracy Shaw is the executive director for the Captial Division of the March of Dimes and joins us to talk about maternal health and outreach. Also joining us is Sacramento State University student Sean Johnson, whose son was born prematurely. Both of them are participating in the upcoming March of Dimes, March for Babies fundraising walk on Saturday, April 26th. Tracy and Sean, welcome to Insight.
Hi, Pam. Good morning.
Hi.
Good morning. The March of Dimes places a lot of emphasis on maternal health and nutrition during pregnancy, even before pregnancy. So let's walk through the stages. Tracy, how critical is nutrition and maternal care even before one gets pregnant?
Pam, it's amazingly important for babies and their mothers to get care even prior to conception. That's what we call preconception. And folic acid is one of the major initiatives that is an important role in preconception. Neural tube defects are affected by the amount of folic acid a mother has in her body prior to becoming pregnant. And so that was one of the major initiatives that March of Dimes dealt with in the early 90s, and we've come a long way.
So what are good sources of folic acid?
Like dark leafy green vegetables, asparagus. Cereals also now are fortified with folic acid. So there are lots of very inexpensive available options out there.
What about during pregnancy? What's your best advice for prenatal nutrition?
I think really, taking a multivitamin, a prenatal multivitamin, and really working closely with your doctor. There are so many conditions that can be affected and identified prior to the baby being born that we can really affect outcomes. And so really working with your healthcare professional.
More and more births are being scheduled a little bit early for non-medical reasons. I personally know a few people who have done that. And the March of Dimes recommends that moms stay pregnant for at least 39 weeks. Now, why 39?
It's interesting. I think, in the past, people felt that once you hit that 36-week marker, that your baby was ready to go at any point. And through our research and our partnerships, we have been able to identify that the baby really is not fully developed until that 39 and a half week period. A good example is a baby's brain at 36 weeks weighs only 2/3 of what it does at 39 weeks. And so when you look at the impact those last, 3.5 weeks can have, several of our partners, and it's now a nationally recognized standard, have really all but eliminated elective early deliveries. So Sutter Health is one of our large partners on the clinical side as well as the programmatic side, and they were one of the initial pilot hospitals to see taking the elective delivery decision and making a hard stop. Mm-hmm. If the baby was not at 39 weeks, there was no way a doctor was going to sign off on an early delivery. And they saw an 83% drop in the number of babies that needed to be treated in the NICU by making that hard stop.
What a tremendous difference. Now, the CDC defines preterm as before 37 weeks. And Sean, your son was born 2 months early. Tell us your story.
That's correct. Yeah, we were stationed in North Carolina, and we were involved in a major car accident. And my son was born 2 months early. Mm-hmm. Yeah, it was an emergency C-section. And although the entire experience was very surreal for me, mm-hmm. there's one moment that really stands out in my mind. And it was about 2 weeks into it, and the nurses said I could finally reach into the incubator and touch my son for the first time. And I was kind of nervous because I'm kind of a clumsy guy, so, But I reached into there and I touched the palm of his hand, and the most amazing thing happened. He gripped down so tight on my finger, and all the worries and all the fears that I had just went away in that moment. It was almost as if he was telling me that he was fighting for his life.
How long was your son in the NICU?
He was in the NICU for 2 months. And it was the most traumatic time in our family's life. But, he's 12 years old now. He's rambunctious, gives me a lot of trouble, just like any other 12-year-old should.
Is he your only child?
I have another. I have a daughter. She's 10 years old.
Excellent. We love healthy children.
Yes.
Well, Sean, given what you and your family have been through, you called it the most traumatic thing you've ever been through. What does the effort to help babies start healthy lives mean to you?
It means so much to me. You know, I always regretted that I never got a chance to properly thank the doctors and nurses that saved my son's life. And I feel like this is a great opportunity, and it's a great opportunity for the entire campus. We've seen such a tremendous effort by the entire student body, faculty, and staff to come together for this great cause.
You're talking about the campus of Sacramento State, of course, which is
That's
partnering
correct.
with the March of Dimes in the upcoming March for Babies. I'm talking with Tracy Schall of the March of Dimes and Sacramento State student Sean Johnson, whose son was born prematurely. Tracy, the importance of maternal care is very well established, but what hurdles do you face in spreading the message?
I think, our mission really revolves around research, but it's also on the educational and advocacy side. Really, our mission is to be a partner with those families that are facing this critical juncture in the life of their baby. So, working with our health practitioners on the educational side, on the importance of nutrition, the importance of care. It's really a grassroots effort to get that message out. And that's why our partnerships with the healthcare professionals are so important.
So efforts on the ground. How about in the medical community?
The medical community, really, our efforts revolve around partnering with them and, utilizing them as research partners, but also more as part of our pilot programs, as I discussed with the Sutter Health Early Elective program that we did. Really, they are the, feet on the ground, making these things come to reality. And so having the ability to take this research and the hypotheticals that we've developed, this makes sense, and being able to translate it to real life, that's really where our mission comes to life.
Are there certain communities or demographics that are challenging for you to reach?
There definitely are. I believe that some of the language barriers that exist, one of the beautiful things about California is our diversity. But I think also for a state of 38 million people, one of the challenges for March of Dimes in the state of California is really reaching the different ethnic communities that are actually more greatly impacted by prematurity than any other of the diverse ethnic groups.
What efforts are being made to reach those groups?
We're actually working right now with the Department of Public Health and helping them to restore the Black Infant Health Program. During the budget crisis that we faced, a few years back, that program was substantially cut in the budgeting process. And so we recognize the importance of that program being fully funded and coming back to life to really help eliminate this large disparity between the number of African American babies that are being born prematurely versus other ethnic groups.
Sean, you've told us your story. What made you take the additional step and go beyond your experience and decide to get involved in the cause?
Well, I'm involved in a great program on campus, a public relations program where we campaign across the community to get our messages out. And this semester, we had the great opportunity because President Gonzalez is the regional director for the March for Babies. And so we've decided to take that on as our role this semester.
That's President Alex Gonzalez of Sacramento
Correct.
State. What would you say to someone who wonders why should I get involved in the cause of maternal health and healthy babies?
I would say this affects everyone. This affects families across the nation. This could affect you in the future, and this may be affecting a loved one or friends.
You have a big event coming up, the March for Babies. Tell us about that.
March for Babies is presented by Sutter Health and is taking place on Saturday, April 26th at the west steps of the state capitol. And it is an opportunity for people to come out and celebrate their healthy babies and also recognize those that they've lost. We're expecting about 7,500 people that day. And as mentioned, Dr. Gonzalez has served as our chair for this year. So really invite everybody to come out, enjoy the day, get an opportunity to hear why we have so many wonderful corporate supporters and so many families supporting this effort.
How can people get involved, assemble a team maybe, and get together?
Absolutely. They can go to the website. It's www.marchforbabies.org, and it will allow you to join a team, start a team. We still have 8 days to go, so it's not too late, and we invite everybody to come out and support the efforts to give every baby a healthy start.
Sean, how will it feel for you to be among people who've been through a similar situation such as yours in this show of unity?
Oh, I'm looking forward to April 26th. I think that it'll be so wonderful to see all of our students and faculty and staff out there. It'll be great to see the entire community, so it'll feel wonderful.
Tracy Shaw of the March of Dimes and Sacramento State student and dad of 2 healthy kids, Sean Johnson, thank you for sharing your stories with us today.
Thank you.
We have links and event information on the March for Babies on our website, capradio.org/insight. You are listening to Insight from Capitol Public Radio. Coming up, the granddaughter of Norman Rockwell makes a name for herself.